Колеги, доброго дня.
Dear colleagues, good morning. And Ukrainian Crisis Media Center is now going to meet the deputy head of the regional civil military administration. So we are giving the floor to Olga Lishyk. Dear colleagues, dear journalists, good morning. Our matter is very urgent for Luhansk region now. As of September, there are 24,000 IDPs registered in the Luhansk region, or 1,800 families. These people, they flee to the government-controlled territory from the territory of the conflict. We give them targeted assistance, and they receive it in time. Although they have problems, and we tackle these problems. They can't get their benefits, and we address the Ministry of Social Policy so that they resolve the problems of benefits granting in time to the IDPs. 34,000 of households of IDPs have been granted the benefits already, and they receive their benefits. The significant aid is provided by international institutions since the start of the conflict in the east of Ukraine. There are many international institutions such as High Commissioner and United Nations and operative aid, urgent responding with food, water, since the IDPs in the three districts such as Popasna region, people were living in basements, and people received food there because we brought the food there. And international Red Cross organization helps with food and also construction materials. There are very many families which fled from the front line. They are Nova Aidar region, Popasna region, and other regions. There is a legal collision that the Cabinet of Ministers order from 18 February to 2014, number 1082, from July 2014, they amended the line of the conflict. The Donetsk region had the contact line, and the Lugansk region has no contact line denominated. And the Prime Minister, we addressed the Prime Minister, and he issued the order to the authorities to establish the contact lines so people whose houses are ruined, these people can't get aid, can't get their benefits. We hope that the security bodies will soon tackle this matter. We also have the problems with children of IDPs who have no representatives. in the joint efforts with the ministry, the regulation number 636 was adopted, and this order regulates the procedure of working with the children who has no representatives or parents here in the government controlled territory. But we still have many questions in this field. IDPs now have such an important experience, the problem of destroyed houses, and there is no mechanism of rehabilitation, restoration of the ruined houses. The money have been received by the administration for the rehabilitation of infrastructure and schools, but where the private houses are in question, residential flats are in question, we can't pay to private individuals so that they rehabilitate their flats, their apartments and their houses. We have had the meeting of the joint group of the Agency for Restoration of Donbass, and we have addressed there these matters of ruined houses, and we hope that our recommendations will be included and incorporated in the regulatory documents. As concern humanitarian aid, the aid is supplied from the Red Cross to international and local Ukrainian organization. Also, United Nations work with our region, and United Nations provides food within the framework of their projects. As concerned the victims, the individuals who are victims of the hostilities, we don't see how to compensate people for injuries. Many individuals got injuries and many people have died, but they are considered as just ill persons, but this is not an accidental injuries. These injuries have been received due to the hostilities, so we appealed to the ministry seeking the way to support and rehabilitate these injured persons. There are some positive examples when people from the village of Jelabok who moved from their village, their bus was exploded by the militants, and now we have a good example. We paid for their rehabilitation. Our region suffered very much, and medical institutions or facilities, equipment, which are very costly, everything remained in the city of Luhansk, and the decision has been made that in the government-controlled territories we will restore the operations of regional hospitals. We have already done then this Luhansk General Regional Hospital has been moved by us to the government-controlled area, and we also opened the Children's Regional Hospital and AIDS Center and other centers, and people receive medicines and hemodialysis, and we operated 600,000 people, and we thanks Kharkiv and Kiev medical institutions with the complicated cases of childbirth and other complicated diseases. The Center of Heart in Kiev has been taking our children free of charge, and they are surgically operated on heart. For this reason, we have supplied the requests, and we have received 23 million hryvnias to repair the hospitals in Luhansk region. We also work with the UN funds on this matter. As concern the medical institutions on the front line in Shastya, Novoidarsky Rayon, hospital in Stanично-Luhanska and in Shastya, these two hospitals have experienced the more disturbance, the largest losses. The doctors there conducted surgical operations in the very complicated conditions of shellings, and now there is very little staff remained in those hospitals. However, these hospitals now are rehabilitated. We repair them. We put the windows. And in prevention institutions, there are 700 beds operating in this medical institutions, and in Stanично-Lugansk and in Popasna districts, the part of hospitals have been rehabilitated and they are operating now. Although we reduced some beds, which decided to change in one of Popasna hospitals, to change windows, to change heating radiators, so that this hospital start working in the winter. And we get also medicines and bandages from the Doctors Without Borders organization. As concern our next steps, this is rehabilitation of ruined hospital buildings and creation of the good system of medical institutions in the Lugansk region. Thank you for Ms. Olga Lishyk and now we have the time for questions. Громадське радіо. There is information that people from Stanично-Lugansk and frontline villages, they experience difficulties with getting the status of IDPs, but it was also information that their rights to get the status of IDPs was restored. Nowadays, so far, the Cabinet of Ministers has not changed Cabinet of Ministers resolution, but we use the law on IDPs. The first item is saying that IDP is a person feeling the threat to its life and live in the territory of hostilities. This is the resolution 636. We use it, but we also use more fundamental legislation. We take accountability on our administration, but we also are saying people that this may not work. One more question. In Kremina, you said that on the basis of MRIA, there will be a new center for 40 IDPs families will be open. Is this the only example with this center opening in the region, or there are other shelters? Yes, this is not a shelter, this is a social center. This is a good example of cooperation between our administration and the international organizations. Yes, the families have already been identified. They are families of socially oriented families. They are IDPs, and they will work out business plans for their families, for their own businesses. And also we have another center at the sports facilities where we also organized residences for our IDP sportsmen. Unfortunately, Luhansk region has no residential houses to be fast modernized for IDPs. In the city of Rubezhna, we repair a 5-storied building so that we can accommodate IDPs there. So I think there should be a governmental program on construction of houses for IDPs, which will enable us to first give new jobs to these IDPs who will construct these houses, and also this at the same time they will get the residences. People should be cured from their moral traumas. We also have cooperation with district administrations. We seek for houses in rural houses so that we repair them and provide these houses to IDPs. Sergei Melnichuk, Ukrainian Crisis Media Center, could you please tell us whether you plan to use modular buildings and to build them for IDPs, such as, for example, were constructed near Kharkiv? And do you negotiate with international organizations such modular houses building, and whether the Red Cross help you in this matter? When Kharkiv built these modular buildings from the international organization GIZ, Luhansk region was not included in the program because it was not that time of any understanding whether hostilities will be extensive. Now I don't see the sense in modular buildings. The IDPs see that these modular building districts, blocks, they are now not very successful because they don't, IDPs now don't understand how to pay for utilities there. There are less, the flow of IDPs now has lowered, so we can provide them some houses, but modular houses, this is not the solution. Maybe we will provide houses on easy terms of loans. Now the situation is not very for modular houses. As concerns the Red Cross, they are close to us and they help us. They have been helping us all the time with the water treatment facilities and water pumping facilities and bandages and very global large scale they provide. One more question. What kind of experts do you need in your administration? What do you mean? We can see now that there is optimization of civil service in Ukraine, and in our administration we experience such natural optimization because most of our staff is IDPs. So our administration has on the payroll about 200 people instead of 600. We don't have enough medical staff. We don't have enough social staff because the load on us is very high. And in the department on social defense has not enough specialists. We have many very good specialists in the educational department. They are from the non-controlled territories. They moved from there. We don't have enough economic experts, so such persons who are capable to develop economic programs, and we would be very grateful if some economic experts can come to us and provide consultations and develop programs. Could you please specify about the data about the Japan aid? What have they provided? Have they provided money or equipment, and what were the amounts? And as concerned medical institutions, do you have enough funds from the governmental budget for development of medical infrastructure? As concerned cooperation with the government of Japan, we have already identified the projects. This is not financial aid. This is the aid in the form of repair of the facilities. UNDP project for rehabilitation of children, disabled children, and repair of the kindergarten in Svatove and Central Medical Hospital in Svatove, and rehabilitation center for disabled children in Kremena and also in Severodonetsk. The funds provided by Japan go to this project on repair of these socially important buildings, and also the Japanese government is going to provide us medical equipment. This is an MRT apparatuses which we wait from Japan. We would like to rehabilitate the hospitals which we had before, but also we have a chance to start pilot projects from scratch. We can see now what was the excessive, what was the odd in the activities of medical institutions in previous times. Now we take account when we build facilities and create hemodialysis centers and tuberculosis center and AIDS center. We have had a meeting with the representatives of the Ministry of Healthcare. We don't have laboratory for these patients. So we develop our medical institutions incorporating the elements of European standards and European practices. I'm not sure that in Lugansk region we have any enterprises which can help with insurance money. Do you have any more questions? Well, the last question, please. Tatiana Kolosova, Ukrainian Crisis Media Center. There are ordinary problems in the extraordinary situation for Ukraine, and they are places of residence, jobs, and also collisions in the legislative domain. And taking into account the extraordinary but controlled situation in your region, what would you place as a priority? What problem is the most urgent and needs the priority solution from the NGOs and the government? What kind of assistance is the most needed by your administration? Is there any collisions, conflicts between IDPs and the communities which accommodates them? Is there any tension? I know that in some settlements the population has increased by 30 or 40%. Have the situation changed in terms of crime? Is there any tension in the society? Globally, what the government should resolve is to make peace for the whole Ukraine and globally, and for the Lugansk region in particular, because the investments which we would like to engage, the investments like peace, if we have no peace, then the Lugansk region will develop in a very hard conditions. We, for example, would like to develop rural regions or start such Azot in enterprise, and it works with ammonium, and it is a very risky enterprise, and it is not possible so that Azot start operating when we have no peace. And also as concern the day-to-day circumstances, not in every domain we have everything successful, but we have the expert staff and the ministry also respond to our requests, and we have urgent communications, and also our problems are addressed at the legislative level as well. All ministries send to us their representatives. Especially important for us is the medical institutions and assistance to them. Without the third level of medical aid, it would be very hard to cure our residents. And when we have complicated childbirth cases, we should bring our patients to other regions. As concerned the IDPs in the districts and cities in our region, we don't experience tension. All communities have united and help the IDPs. There are no negative attitudes demonstrated. all IDPs children visit the kindergartens and go to kindergartens and schools. We don't have any increase in crime sphere, and I would like to say that strengthening of the defense of the cities also has been improved and provided the results, and I would say that the youth, which is more energetic, they understood problems and they are now more careful to their own health and to the problems in communities, and they help police to identify crimes. Thank you, Ms. Lishyk, and we hope that we can hear your briefings once or twice a week in future. Colleagues,